that is the first question which is coming into everyone's mind. So during my PG days, after coming into the real practice, I used to face, or we clinicians used to face, so many cases of fever. So we used to get classes or trainings for diabetes, hypertension, or sometimes cardiac diseases, respiratory diseases, but we seldom get training or guidelines or any pearls in the field of pyrexia, that's the fever. We know that after the post-COVID era, the infections are gaining more importance. We are dealing with almost all the topics in today. We are dealing with the gram-negative MDR-resistant infections, fever in ICU, and different aspects of fever. We have two stalwarts who is very good in clinical medicine, our own Sharma sir and Muralidharan sir. So it's my pleasure to invite our great clinicians to this Pyrexia 23. Along with that, we have very good teachers. I have 3 or 4 teachers who taught me the basics of clinics from different medical colleges. So it's a place where clinicians meet the teachers. So I'm not extending my speech. So I'm welcoming all of you, all the clinicians, all the delegates, all the speakers to the Pyrexia 23. A warm welcome to all of you. So we are state of it. There is 2 difference from other conference to this conference that I'll highlight. So one thing is that in this conference, we are introducing one new thing called brain teasers. Like all the people who wrote entrance will be knowing about brain teasers. Like after each chapter, there will be one brain teaser and like that. So before each topic, there will be a small brain teaser which will deal with 1 or 2 infections. So at the end of the sessions, we will be knowing a little or much about the infections. So we will start. The brain teaser section will be dealt with Dr. Rajesh, who is the Associate Professor, Government Medical College, Thrissur. So we will be right away going to the Pyrexia 23. So you have a WhatsApp group. All the delegates and speakers are part of the WhatsApp group. So during any talk, if you have any doubt, you can type it on your WhatsApp group. It's just to ease the way to ask questions to the speakers and to get maximum benefit from the speakers. So who is not in the WhatsApp group of Pyrexia, they can contact Dr. Adarsh. He will help you. Okay. So right away we are moving to our first brain teaser, and we will be moving to the first talk. So I am inviting Dr. Rajesh, who is the Associate Professor, Government Medical College, Thrissur, to start with a brain teaser to all of you. Thank you.
Good morning, respected teachers. And first of all, I thank Hospex team and my batchmate, Dr. Arun and Jom, for inviting me to this session. And I am happy to see my teacher, Dr. Madam Sheila Madam and Purushothaman sir. So I'm not making, actually we are planning to the training physicians only. There may be controversies because the evaluations of these cases were done with minimal resources, not very high-tech investigation. So actually, I will give a small history and clinical examination, and we will allow it to think about the possibilities, and we will convey it later after the first speaker's talk. So moving to the first case. So the case will be framed in such a way of there will be a short history and small examination. I know a case taking wouldn't be complete with an elaborate history, but with the time constraint, the essential things only will be covered. Next slide. So this is a first case. It's a storm from the desert. A patient referred, not from, actually visited a place, a desert in our state, in India. The case 1. Next slide. This was a 14-year-old male. Actually, he presented to us with high-grade fever of 1 week duration, which was having high-grade with chills and rigor. And he had a non-bloody diarrhea, which started 2 days after the onset of fever. and he was a dry, non-productive cough and a dull aching headache. And he gave a history that he had a recent travel to Ajmer for a religious purpose, and he returned 25 days prior to hospital admission, 25 days prior to hospital admission. And he had a history of street food intake during the period of travel from Rajasthan. On examination, he was toxic. His vitals, blood pressure was around 90/60. He was dehydrated. And there were multiple diffuse petechial spots present predominantly over the chest, abdomen, wall, thighs, and legs, and blanching skin rashes and no eschar, and mild spleen. Spleen tip was just palpable. And when he presented to us, he had a fever of around 10 days. So fever was persisting even after 7 days. Next slide. So this was the investigations. Strikingly, there was leukopenia, and there was thrombocytopenia. And you can note that compared to that inflammatory state, the ESR 8, 12, 14, 30, ESR was not as expected. So actually, the question is, what are the possibilities to be considered, and what is the most likely diagnosis? And second, and why there is a disproportionate pancytopenia with a low ESR. So I will stop here, and we will have a time for discuss on that, and we'll move into the next speaker.
Thank you so much, Dr. Rajesh KR. It's said, knowledge is like a garden, and if it's not cultivated, it cannot be harvested. We have come here to enrich ourselves with knowledge, and this knowledge has to be improved, challenged, and increased consistently, or else it vanishes. So, CME is a pulse of progress in medicine, and for this CME, we have with us the best speakers across India. So, without any further delay, let's start today's sessions.